Hello everyone. We know everyone suffer with some kind of conditions. It may be physical disorder or kind of any disorders. But when we talk about mental disorders, majority of the people are not aware which kind of mental conditions they are suffering. Even though the mental disorders are one of the major causes which we can see in the current society, and majority of the people are affected with many of the mental disorders. To list down some of the mental disorders, maybe the people are aware about depressions, mania, psychosis, anxiety disorders. In the same way, we have one of the major conditions which it is called as a schizophrenia. And schizophrenia is a condition where we can see majority of the people suffer with this schizophrenia condition. And let me discuss what is this schizophrenia, what are the causes of schizophrenia, and what are the clinical manifestations of schizophrenia. And when we talk about the history of schizophrenia, the history of schizophrenia was started by Emil Clapin, who has explained in the year of 1896 the schizophrenia was earlier referred as dementia praecox, and which was called as a mental deterioration. And later in the year of 1911, Eugen Bleuler, he has coined the term schizophrenia, which was referred as the split mind. And later Kurt Sisner, he is a psychologist and a psychiatrist who have found there are the first time symptoms of schizophrenia, which are namely there are 11 first time symptoms of schizophrenia. And coming to the definition of schizophrenia, what is schizophrenia? So schizophrenia is a psychotic condition which is characterized by disturbance in thinking, emotion, volitions and faculties in the presence of clear conscious, which usually leads to social withdrawal. When we discuss about the definition, the common characteristics, what we can see in the schizophrenia patient is the disturbance in thinking. We know thinking is the major part of the cognition function. The thinking is disturbed here. The emotion is nothing but we call commonly as a mood and affect. So that here the emotion part also is affected. And when we think about the volition and faculty in the presence of clear consciousness, to say here the important thing is the patient is have completely disturbed in this all three major areas. Coming to the classification of schizophrenia, so here there are mainly three classifications which are given for the psychiatric condition. One is ICD-10 classification, DSM-4 classification, Indian classification of psychiatric disorder. But majorly we are using the ICD-10 classification. According to ICD-10, the schizophrenia is classified in the category of F20 to 29, which is listed as schizophrenia, schizotypal and delusional disorder. In that, commonly we have a F20 to F29, which are listed like F20 schizophrenia, F21 schizotypal disorder, F22 persistent delusional disorders, F23 acute and transient psychotic disorders, F24 induced delusional disorder, F25 schizoaffective disorder, F28 other non-organic psychotic disorder, F29 unspecified non-organic psychosis. But when we talk about schizophrenia, where I am going to discuss today only about schizophrenia, here F20 is again subclassified into, the schizophrenia is again subclassified into F20.0 to F20.9, which referred as the subclassification or subtypes of schizophrenia. Like namingly, the schizophrenia has a different types, that is paranoid schizophrenia, epiphrenic schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, post-schizophrenic depression, residual schizophrenia, simple schizophrenia. And along with that, we have a schizophrenic unspecified and schizophrenia. So these are the major subclassifications of schizophrenic conditions. Coming to the important aspect, when we talk about the causes, we know when we talk about medical conditions, the medical conditions have a certain specific causes. But when we talk about the mental conditions like a psychiatric conditions, we identifying the causes becomes most difficult here. And when we talk about the causes of schizophrenia, the schizophrenia causes are listed into the biological theories, psychodynamic theories, vulnerable stress model and the social factors. So when we talk about the biological theories, again it is classified as the biochemical theories, neurostructural theories, genetic theories and perinatal risk factors. And about psychodynamic theory, it is classified like a developmental theories and family theories. So let me discuss in brief what are these causes of schizophrenia. To talk about first one, the biological theories in that biochemical factor. When you talk about biochemical factor, the first thing to remember is the neurotransmitters. We know in the nervous system we have a brain and its structures. In that, commonly the neurotransmitters are the chemicals which are commonly help for the transmission of nerve impulses from one nerve to another nerve. So here the majorly two important biochemical theories suggest here is, one is dopamine hypothesis, second one is other biochemical hypothesis. So dopamine hypothesis is majorly what the talk is here is there is a excess amount of dopamine dependent neuronal activity which leads to the schizophrenia. So the major cause in the neurochemical is the dopamine, and not only the dopamine, apart from certain neurotransmitters which are responsible for causing schizophrenia are like a norepinephrine, serotonin, acetylcholine, gamma aminobutyric acid, that is GABA, and abnormalities in the neuroregulators such as prostaglandins and endorphin also some are responsible for causing the schizophrenia. So these are the biochemical theories which causes the schizophrenia. Coming to the neurostructural abnormality, when we talk about neurostructural, it mainly about the structure or functional units of the brain. And when we come as a structure and function unit of the brain, commonly the parts of the brain which are commonly affected in the schizophrenia. So here majority of the research evident that there are some abnormal structure which we can see in the schizophrenia. So that includes the prefrontal cortex and limbic cortex may never fully develop in the brains of the persons with the schizophrenia. When they have done the research and when they have done a certain CT scan and MRI studies, they have found these are the structural abnormalities which can be seen into the brain structure. Like here some of the examples like the CT scan and MRI studies of the brain structure in the schizophrenic patient shown that decreased brain value, large lateral and third ventricles, atrophy in the frontal lobe, cerebellum and limbic systems, and increased size of the sulci of the surface of the brain. And coming to the next cause, the genetic theory. So genetic theory mainly talks about the genes and the hereditary factors. When we talk about here the genetic factors, so here some of the point discussed about the genetic factors which are responsible for causing schizophrenia. Here it is more common among the people born with the consanguineous marriage. We know in the history, we talk about our forefathers, they used to do many consanguineous marriages, and that consanguineous marriage is one of the main causes for developing this schizophrenia. And identical twins are affected with the 50% if the both twins are identical, which commonly we call as a monozygotic twins. If the one twin is affected with the schizophrenia and another twin is risk for developing a schizophrenia is for 50%. And fragmental twins is affected with 15%. So fragmental twins are nothing but we commonly referred as a dizygotic twins. And if the brother or sisters are affected, the risk is 10%. If one parent is affected, the risk is 15%. And if the both parents are affected, the risk is 35%. And to talk about the second degree relatives, it is affected 2 to 3%. And with the general population, if we talk about the ratio is 1%. So these are some genetic theory which we talk about the causes of schizophrenia. Coming to the next, the perinatal risk factor. The perinatal risk factor is talking about the antenatal, intranatal and postnatal. We know many times the pregnancy, labor and postnatal period, sometimes the mother will not develop some physiological complications. Sometimes there is a risk for developing the psychological complications. In that, schizophrenia also one of the major conditions which commonly we discuss. And here the common factors, risk factor during the maternal factor includes like maternal influenza. If the mother is suffering with maternal influenza, the risk for the baby is to develop a schizophrenia. If the birth is during the late winter and early spring season, and complications of pregnancy, particularly during the labor and the delivery, if like many times we go for some of the instrumental delivery, sometimes we go with some assisted deliveries, that time the risk is more common with the development of schizophrenia. Coming to the next psychodynamic theories, the psychodynamic theories commonly focuses on the developmental aspect, and here the developmental theories in the schizophrenia is commonly discussed by the Sigmund Freud, where he has explained certain stages into the psychosexual development theory that are commonly oral stage, anal stage, phallic stage, latency stage, and in that stage commonly what he has explained here is when the child is not able to perform certain activity into the certain developmental stage, sometimes it may be leading to the development of schizophrenia into the later stages of development. And also he has told about the defense mechanism which commonly say about the id, ego and superego. So and when we talk about the structure of mind, id, ego and superego are the three major components that are also responsible for causing the schizophrenia. And coming to the family theories are mainly discussed into the three headings, that is mother-child relationship, dysfunction family system, and double-blind communication. So mother-child relationship, commonly it discuss about if the mothers of schizophrenics are as cold, overprotective, domineering, and thus retarding the ego development of the child. Commonly what will happen when the mother is suffering with the schizophrenia, the mother may becomes overprotective, or she may be dominating the child, and that may be affecting the child in the later period of stage. And next one comes dysfunctional family system, where it is nothing but it is a hostility or marital disharmony commonly we call as, that is also becoming one of the cause for developing schizophrenia. And the third one comes as a double blind communication, where the child is receiving the double communication from the father as well as mother. So here one statement, the father is saying for right and the mother is saying a wrong. So here that conflict for the child, it may leads to development of the schizophrenia into the later stages. And next, coming to the vulnerability stress model. So nowadays most of the people are not aware how the stress is impacting on the health of the people. But here, according to the stress model, what they focus is the stress also is one of the hindering factor to cause schizophrenia. So they have developed into the vulnerability stress model. And here mainly they have focused certain stressful life events which every day the person is or individual is undergoing. That life event also one of the causes for developing schizophrenia. And social factor, when we talk about social factor, many research have evidently shown that, and these are very commonly seen in the high social mobility and the disorganized people, also especially among the members of very social low economic classes. And also the stressful life events, I would just discuss about the stress model. So here stressful life events also one of the main cause for developing schizophrenia. And these are the causes of the schizophrenia which are listed into the different headings. Coming to the clinical features of schizophrenia. So when we talk about the clinical features here, the different people have given the different classifications of clinical manifestations, and one important thing to focus here is the clinical features of schizophrenia is completely depend on the type of schizophrenia which the patient is suffering. And that one we will discuss in the later phases, where we are going to discuss the types of schizophrenia. But here what I am going to discuss is, these are the general signs and symptoms where we can see into the schizophrenia patient. The first clinical features which is explained like a 4 A's of schizophrenia, which was explained by Eugene Bleuler. He said that the patient who is suffering with schizophrenia commonly affected with 4 A's, which refers to the blunted affect, autism, losing of association, ambivalence. And what are these 4 A's? The affective disturbance. The affective disturbance refer to the inability to show appropriate emotional responses, that is nothing but the blunted or the flattened affect. And what is autistic thinking? So autistic thinking, it is a thought process in which the individual is unable to relate to others or to the environment, the perception with the self and the little concern of the external reality. So here you can see certain images where you will understand what is affective disturbance. There are different kinds of emotional expression where you can see their complete emotion or affect is disturbed, and where you can see the autistic thinking how the first person is perceiving, how the second person is perceiving, the third person is perceiving. And ambivalence. So ambivalence, it refers to the contradictory opposing emotions, attitude, ideas or desire for the same person or a thing or situation, simultaneous opposite feelings. So here the person will be having in the state of confusion whether it will be there is a conflict of anything, it may be two ideas, emotions, attitude or any feelings. And the last A is associative looseness, that is inability to think logically, that is the stringing together of unrelated topic. So these are the 4 A's which is explained by Eugene Bleuler. And next, coming to the next classification of symptoms, the positive and negative symptoms of schizophrenia. So here some of the positive and negative symptoms of schizophrenia which are listed are like positive symptoms of schizophrenia are delusion, hallucination and disorganized speech. Commonly we refer these symptoms as the positive symptoms of schizophrenia, and negative symptoms of schizophrenia includes flattened affect, reduced speech and lack of initiative. Along with that, some of the additional clinical symptoms also we can see into the patients. And also in the history only I have mentioned the Kurz Sisner, he has given the first time symptoms of schizophrenia. Namely, there are 11 first time symptoms of schizophrenia. So there are audible thoughts, voices arguing, voices commenting on one's action, thought withdrawal, thought insertion, thought broadcasting, made feelings, made impulses, made volitional acts, delusion perceptions, and somatic passivity. So these are the 11 first time symptoms which are listed by Kurt Sisner, and he says that these are the major symptoms where we can see at the initial stage of the schizophrenia in the patients. And next, coming to the general features where we can see when we assess the mental status examination, we can see some of the clinical manifestations. We can list down according to the components of mental status examination. In that, to talk about the first clinical manifestations which we can see in the thought and speech disorder, the symptoms which are related to the thought and speech disorders like autistic thinking, loosening of association, thought blocking, neologism, poverty of speech, poverty of ideation, echolalia, perseverance, verbigeration, delusions, over-inclusion, impaired abstraction, concreteness, ambivalence. So these are the listed clinical features which commonly we can see into the speech as well as thought. And coming to the next, disorder of perception. So these are the main important features where we can see in majority of the schizophrenic patients, that are hallucinations. So in that hallucinations, again we have a subclassifications like auditory hallucination, visual hallucination, tactile hallucination, gustatory hallucination, and olfactory hallucinations. So here also the type of hallucination is depend on the type of sensation what the patient is commonly feeling. And next we have a disorders of affect. Affect is commonly deals with the emotions. In that, the common symptoms are apathy, emotional grunting, emotional shallowness, anhedonia, inappropriate emotion responses. Next, coming to the disorders of motor behavior. The disorders of motor behavior which is concerned about the psychomotor activity of the patient. So here it includes, it may be increase or decrease in the psychomotor activity. Sometimes the patient may be overactive, or sometimes the patient may not be, not active that much in participating in the self-care activities. And the patient may show certain mannerism, grimacing, stereotype, decreased self-care, poor grooming. And along with that, there are certain other features which are discussed like decreased in work function. As we know, the schizophrenia is one of the major psychiatric conditions where it will affect the work function entirely to the patients. Decreased social relationship, where the patient is not mingling with the society, not talking to anyone, or not going for any or social activities. Decreased self-care, inability to concentrate, tension, insomnia, withdrawal or cognitive defects, or loss of ego boundaries. So these are some other features which we can see into the patients. Along with that, when we do the mental status examination, common things which we assess is the loss of insight, poor judgment, and suicidal tendency. And we cannot see in every patient, the schizophrenic patient, they have a suicidal tendency. But if the patient is having some associated depression, command hallucination, impulsive behavior, in that cases commonly we can see as a suicidal tendency is one of the clinical feature. And when we talk about, the important thing is here, that usually the patient does not have a disturbance in the consciousness, orientation, attention, memory, and intelligence. So when we are doing the mental status examination, keep in mind that these areas or these components of the mental status examinations are not affected, that are consciousness, orientation, attention, memory, and intelligence. So these are the clinical features which about the schizophrenia. So till now we have discussed about what is schizophrenia. So schizophrenia is a psychotic condition which is characterized by disturbance thinking, emotion, and volitions. And we have discussed about the causes of schizophrenia. So mainly the causes of schizophrenia are biochemical, biological theories, genetic theories, stress model, and social factor. And also we have discussed the clinical features. The clinical features of schizophrenia is given by different people, and we have discussed some of the clinical features like 4 A's of schizophrenia, positive and negative symptoms of schizophrenia, the first time symptoms of schizophrenia, and the clinical features according to the mental status examinations when we are performing. So here I am going to conclude the topic that hope this topic may be helpful for you in the clinical to understand certain clinical manifestation in the patients, and it will help you to differentiate the different types of schizophrenia into the patients. Thank you.